Beyond Midnight. The Nurse from Hell. Leeds, England. The year is 2002. Inside the sterile, fluorescent-lit corridors of Leeds General Infirmary and St. James's University Hospital, patients were admitted to get cured and recover. Some were elderly and frail, entirely dependent on the care of the medical staff assigned to protect them. But in the quietest hours of the night shift, a quiet crisis began unfolding, one marked not by sudden violence, but by a silent medical collapse. It began as a medical mystery. Vulnerable, and most importantly, non-diabetic patients recovering from routine surgeries were suddenly slipping into deep, irreversible hypoglycemic comas. Their blood sugar levels were crashing to near deadly levels for no apparent physiological reason. In the high-stakes environment of a busy hospital, these tragedies were initially written off as natural failures of the human body. But as the months pressed on, a terrifying pattern began to crystallize, pointing directly to a single staff member on the ward, a young male nurse, Colin Norris. To understand how Colin Norris ended up in these wards, you have to look back at his life before he ever put on a nurse's uniform. Born in Glasgow, Scotland in February 1976, Norris grew up in the Milton area of the city. He appeared to be an ordinary young man, but his friends described him as someone who loved being center stage and enjoyed amateur dramatics. Academically, he was fairly average, leaving school with standard qualifications. His path to medicine was not a direct one. Initially, Norris worked as a travel agent after leaving college. However, after a few years in the travel industry, he decided to completely switch careers and train as a nurse. But as he entered his training at the University of Dundee's School of Nursing and Midwifery in 1998, a more volatile side began to show. Norris developed a reputation among staff for being quick to anger and fundamentally aggressive. He engaged in fierce confrontations with university lecturers and tutors, with his behavior eventually being described by faculty as entirely unacceptable. He clashed deeply with his personal tutor, a toxic personality conflict that Norris later admitted openly, revealing a profound inability to handle authority or criticism. During his studies in 1999, Norris attended specific lectures regarding diabetes and the treatment of diabetic patients with insulin. He also undertook practical work placements at Ninewells Hospital and the Royal Victoria Hospital in Dundee, where he cared for elderly patients and learned how to manage insulin dosages. It was during these early institutional placements that colleagues noticed a troubling, hardened shift in his attitude. Behind his theatrical exterior lay a cold vein of arrogance and laziness. Norris openly expressed a severe dislike for working with elderly patients or sitting in quiet wards. He made it clear to fellow staff that he preferred the high-intensity environment of the emergency department because it was more exciting. He wanted to be where the action was, viewing the routine care of the elderly as beneath his ambitions. One of his female patients, Bridget Tarpey, later provided a chilling summary of his demeanor on the ward, noting that he was unpleasant in many ways and made it obvious that he didn't like us old women. After qualifying as a nurse in 2001, Norris relocated to West Yorkshire, securing a position on Ward 36 at Leeds General Infirmary. He quickly established a pattern of friction with senior authority figures, struggling significantly whenever he was told no or given direct orders. The breaking point in his career as a nurse came in November 2002. 86-year-old Ethel Hall was admitted to Ward 36 following a fall that fractured her hip. She underwent surgery and was considered by doctors to be recovering reasonably well. But in the early hours of November 20th, her condition dramatically took a turn for the worse. Hours before her collapse, Colin Norris reportedly made an eerie prediction to a fellow nurse on duty. He casually remarked that he had a feeling about Ethel Hall, explicitly stating that he predicted 5:15 a.m. as being the exact time she would become unwell. He had previously told colleagues that whenever he worked nights, someone always died, complaining that it was just his poor luck that he would have to do the resulting paperwork. Right on cue, at approximately 5 a.m., Ethel Hall fell into a sudden deep coma, subsequently suffering a cardiac arrest. The precision of Norris's prediction immediately raised alarms among the medical staff. Suspicious of the sudden downturn, a consultant ordered a specialized blood test. The results were staggering. Ethel Hall's blood contained a massive, inexplicable level of insulin, nearly 12 times the normal limit. Crucially, the lab tests revealed a critical scientific anomaly. The sample lacked C-peptides, which are the natural byproducts the human body creates when producing its own insulin. The complete absence of C-peptides proved that the insulin had been introduced externally and artificially. It was manufactured, man-made insulin. Furthermore, medical staff discovered a physical bulge under the skin of her abdomen, entirely consistent with a massive localized injection of fluid. The hospital administration immediately contacted West Yorkshire Police. As detectives dug into the case, they discovered that 2 vials of actrapid insulin had gone missing from the ward fridge during the exact night shift Norris was working. The investigation quickly expanded, retroactively reviewing dozens of deaths that occurred on the wards while Norris was on duty. A special medical panel narrowed the scope down to several highly suspicious cases of unexplained hypoglycemia in non-diabetic patients. The deep dive into the records brought older cases to light. In May 2002, 90-year-old Vera Wilby was recovering on the ward. Hospital notes recorded that Norris had administered an unauthorized dose of morphine to her, later admitting he did so to make her drowsy, despite the fact that she was in no pain. Shortly before going off shift, Norris administered a secondary injection. 90 minutes later, Wilby was found semi-conscious, suffering from a severe hypoglycemic attack. She managed to survive the ordeal, but others were not as fortunate. The investigation uncovered 3 other women who had suffered identical, unexplained blood sugar crashes while under Norris's direct care. 80-year-old Doris Ludlam passed away on June 27th. 89-year-old Bridget Bork died on July 22nd. And 78-year-old Irene Crooks passed away on October 20th. In each instance, Norris was on duty, and hospital records revealed he was the common denominator who could not be mathematically eliminated from the timeline of the shifts. Following a highly complex trial, the prosecution laid out a heavily circumstantial case built on statistical probability and expert medical testimony. They argued that the odds of these clusters occurring naturally under one nurse's watch were virtually impossible, painting a picture of a killer who used insulin to exert absolute lethal power over defenseless patients. Throughout the exhausting trial, Norris's behavior in the courtroom only reinforced the state's depiction of his personality. Rather than showing distress, vulnerability, or the weight of the massive accusations against him, Norris maintained a demeanor of detached, icy defiance. Observers and investigators noted a palpable sense of supreme arrogance radiating from the dock. He often sat with an air of superiority, looking down upon the proceedings as if he were entirely above them. When confronted with the damning timelines and medical data, he refused to break. When the prosecution suggested he was a manipulative, lazy individual who felt nothing but contempt for geriatric patients, Norris remained entirely unmoved, flatly denying the claims without a flicker of emotion. He showed absolutely zero remorse or sympathy for the grieving families. On March 3, 2008, the jury found Colin Norris guilty of 4 counts of murder and 1 count of attempted murder. The following morning, as Mr. Justice Griffith Williams branded him a thoroughly evil and dangerous man who likely enjoyed the power that ending a life gave him. Detective Chief Superintendent Chris Gregg summarized the man the police had spent years tracking, describing Norris as an extremely arrogant individual whose confidence had grown to such an extent that he genuinely believed he could kill without getting caught. Colin still remains behind bars, the definitive author of a dark chapter in the history of British medical care. The most deeply unsettling aspect of the case is the question of motive, one heavily intertwined with a dark historic parallel. Unlike many criminals, Colin Norris did not kill for financial gain or a sudden burst of passion. Instead, prosecutors and criminologists suggest his actions were partly inspired by the case of Jessie McTavish, a fellow Scottish nurse convicted in 1974 of killing an elderly patient with insulin at a hospital less than a mile from where Norris grew up. Having learned about McTavish during his university lectures, Norris was believed to have viewed insulin as the perfect, untraceable weapon to alleviate what he saw as an annoying administrative burden. Driven by professional arrogance and a deep-seated contempt for the frail, elderly women under his watch, he weaponized his medical access to transform himself from a frustrated ward nurse into the ultimate arbiter of life and death, playing God in the quiet hours of the night shift. If you made it this far, thank you so much for watching. If you want to help keep these stories alive, please take a moment to subscribe to the channel. It truly helps. If there's a true crime case, unsolved mystery, or any other unexplained event that deserves more attention, feel free to send an email or leave a comment down below.